Hi, I'm Sally Homolka, a physical therapist with our Arnett Health Rehab team. Today I'm here with Kristin Farwell, another physical therapist on our team. She is a certified lymphedema therapist with 8 years of experience treating lymphedema patients. And today she's going to tell us a little bit more about the lymphatic system and treatment of lymphedema. So first, just tell us a little bit more about what the lymphatic system is and what it does for our body.
So the lymphatic system is part of our immune system, which helps our body fight off infection. The lymphatic system also plays a large role in helping to regulate the balance of our fluid within our system. So the lymphatic system is made up of lymph vessels, lymph nodes, and fluid, which is called lymph. The lymph is a clear fluid that is full of lymphocytes, which are a type of white blood cell. The white blood cells are carried throughout the body and help pick up germs, debris, and help us fight off infection. Lymph cells are made in the lymph nodes. The lymph nodes are a cluster of cells scattered throughout the body, but primarily in areas like your armpits, your groin, your neck. And those lymph nodes help to produce those lymphocytes, and also they act as the filtration system for the lymphatic system. So when I explain to my patients how the lymphatic system works with our circulatory system to regulate the fluid balance in the body, I often use an analogy of trains and train tracks. So if you picture your body and you picture your heart as the central station, you have red line or red trains that are your arteries, and they carry the blood away from that central station out into the tissue of your body. So your blood flows out, oxygen-rich, nutrient-rich, and as it goes out to the tissue, you're dropping off cells, nutrients into the tissue as it goes. You then have two train lines or train tracks that bring that fluid back to the central part of your body. So the blue line is your veins, your vascular system, that helps to bring some of the fluid out of that tissue, bring it back up towards the heart. And then you also have your green line, your green tracks, which is your lymphatic system. So the lymphatic system picks up the fluid that the vascular system leaves behind and protein molecules, and it also helps to transport that fluid back to the central part of your body. So in a normal functioning lymphatic system and circulatory system, all the passengers, all the fluid that is distributed out to the tissue by the red lines, by the arteries, is then brought back by the lymphatics and the vascular system.
So what is lymphedema then?
So lymphedema is a chronic lymphatic disease that results in the insufficiency and compromised functioning of that lymphatic system. So going back to that analogy, it means that that green train line has broken down and it's no longer able to transport the fluid out of the tissues and back towards the central part of the system. So there are two main types of lymphedema, primary and secondary lymphedema. Primary lymphedema is a hereditary condition. It is a malformation of that lymphatic system. So basically those train tracks were never built or laid down properly. So symptoms of lymphedema, of a primary lymphedema, can show up at any point in someone's life. Sometimes it's seen as early as childhood and infancy, but oftentimes we don't see the visible symptoms of primary lymphedema until later on in life, later on into adulthood. The other type of lymphedema is secondary lymphedema, and that is considered to be a trauma-caused lymphedema. So you have a normal functioning lymphatic system, and then something happens. That something happening can be a deep cut or bruising injury, a surgical intervention, radiation treatment, and sometimes just even the chronic overload of that system, like an uncontrolled venous insufficiency or chronic obesity, just continued stress on that tissue that causes it to eventually stop functioning the way it should. So regardless of whether it's a primary or secondary, you start to get a building up of the lymph fluid in the tissue layer of the affected area of the body. And as that process increases, or as that tissue continues to swell and build up with fluid, your body starts an inflammatory process. As that continues to go on, you then start to get a change in the tissue texture and makeup of the skin. So it starts to become harder, which we call fibrosis. When that happens, then the function of that tissue starts to deteriorate. So it's not able to move as easily as it was, and the overall tissue health starts to decline. that area where the fluid is present also becomes very prone to reoccurrent infections.
So I guess that's where you come in.
Mm-hmm.
And so what is the management of lymphedema?
So the presentation of lymphedema is very different from person to person. So the specific treatments that we do can vary sometimes. The gold standard for treatment, however, is complete decongestive therapy, or CDT. So CDT is performed by a certified lymphedema therapist. Oftentimes that is a physical therapist or occupational therapist, but it can also be an RN or a physician that has specialized training in it. So complete decongestive therapy has a couple different components. The first component is manual lymphatic drainage, and that is a specific type of massage where the tissue is stretched and mobilized. And what that does is it stimulates the lymphatic system, so it increases the rate in which those lymph vessels contract and relax to move fluid. And we can also attempt to reroute some of the fluid away from the parts of the lymphatic system that are no longer transporting fluid effectively. So in addition to the manual lymphatic drainage, we also do compression bandaging. That can vary from person to person depending on what area of the body is affected, but generally it's multiple layers of bandages layered over each other to create almost like a soft cast that we then use to physically push some of the fluid out of that area. In addition to the manual lymphatic drainage and the bandaging, exercise is also a very important component. Oftentimes patients are doing majority of their exercising at home, but sometimes we can do it in clinic and sometimes we do it actually in the pool as well. Skincare is very important, and also patient education. So those are the main components of the complete decongestive therapy. The main goal in the beginning is to try to get as much of the fluid out of that tissue as possible, to kind of wring out the sponge as best we can, to move as much of that fluid out of the body. Once that is achieved, then we move on to setting up an individualized management strategy that patient then can continue going forward to maintain the size of the limb and help to continue to support their lymphatic system. Those strategies almost always include at least one or more types of compression garments to help contain the area where the lymphatic system has failed. Patients are always doing a home exercise program and manual lymphatic drainage to continue to stimulate that lymphatic system. And then for some patients, we're also able to obtain a specialized compression pump that they can use on a daily basis to, again, further help support their lymphatic system.
Great. So outside of conservative management, is there any other type of treatment or therapy that the patient can expect?
There are some surgical interventions available for some patients. Some patients may be appropriate. One is a lymphovenous bypass procedure, and the other one is a lymph node transplant. These surgical interventions are continuing to advance these treatments, and as more and more research is being done by experts in the fields, we keep looking to see better and better ways that we can help support our patients. In those cases with surgical intervention, certified lymphedema therapists are generally part of that team too, though, to help manage the symptoms during and after those surgical interventions are performed.
Gotcha. So why is managing lymphedema so important?
So lymphedema is a chronic progressive disorder, meaning that if it is left untreated and unmanaged properly, it will continue to worsen over time. Fluid will continue to accumulate in the affected tissue, causing that area to swell larger and larger. And so over time, patients can lose functional mobility and functional capability of those limbs, and then sometimes it can become painful as well. The other important thing to remember that aside from the fluid balance function of the lymphatic system, it is also part of the immune system. So it fulfills an immune trafficking function, meaning that infection-fighting cells are mobilized to tissues that require assistance. So when that system breaks down, those areas can be prone to repeated infection because the surveillance mechanism of the lymphatic system is not working the way it should.
So are there specific keys to successfully manage lymphedema?
An important point to start with is that the early diagnosis and early treatment of lymphedema is important to really successfully manage the condition. If we can start treating and managing the symptoms before we start to get a significant accumulation of fluid and protein in the tissue, and before the tissue changes start to occur, then we can minimize the symptoms that the patient experiences and often simplify the process they have to go through for getting the fluid that's in there out, and then also maintenance for long term. Another really important point is that lymphedema management is a lifelong process. And so my patients that are most successful in managing their symptoms are so because they really look at it as an overall healthy lifestyle. They make good choices as far as the foods that they eat, eating a balanced diet, maintaining a good weight. They are, make sure that their hydration is adequate. They're taking good care of their skin, and they're also staying active. Exercise and activity in general is really important because your lymphatic system is stimulated by muscle movement and breathing. So the more active that you are, the more active your lymphatic system is. So that means that there's more fluid being processed throughout the body, and then your overall immune function is improved as well.
So how does someone get started with treatment of lymphedema?
So here at Arnett Health, we have 3 outpatient physical therapists that are certified lymphedema therapists in the Elmira and Horseheads area. So a patient would contact their primary care physician or another physician that they're seeing, and that provider would put in a referral for a physical therapy evaluation. The patient would then meet with the therapist and have an examination and a treatment plan determined to help them manage their symptoms.
Okay, great. Well, thank you, Kristin. This has been extremely informative and helpful. If you have any further questions regarding the management of lymphedema, you can refer to the contact information that's provided in this video.